I am the Adult Services Librarian here at the library, and I've been working with all of these fine folks from the Raptor Center to provide this talk here this evening. So they're going to do most of the work. But just real quick before we get started, a couple things. Restrooms and drinking fountains are right across the hall. Feel free to step up if you need to during. We are going to ask everybody to save questions for the end. We'll have plenty of time for Q&A, but we'll do all of that after the presentation. Just a heads up for everybody in the room, this event is going to be streamed for the Raptor Center, so it's available for people online, but just be aware that Richard is going to be filming. So if you don't want to be on camera, just pay attention to where the camera is. Let's see. Oh, and then I'm sure we have a lot of bird folks in the room today. So if you are also interested, on Saturday at 2 o'clock, Dr. Wolf from the Animal Hospital is going to be giving a talk in the same room about raising domestic chickens. Last year, it's very helpful, very informative. I have a feeling this year it might involve a little bit more of this kind of stuff as well. So with that, we're going to go ahead and get started.
Awesome. Thank you so much, Margot. Hi, everybody. My name is Sophie Nillis. I am an avian care specialist and also the education coordinator at the Alaska Raptor Center. This is my coworker, River Setzer. River is also an avian care specialist, and we're super excited today to bring you guys information about avian influenza and how this is going to be impacting and how it currently is impacting Sitka and Alaska in general. So I want to make a quick disclaimer that some of these videos that we're going to be showing you throughout the presentation are a little graphic. They do show birds in distress, and they do show just sort of distressing situations. And so I want to make a quick note that if you guys see this little symbol at the bottom right of the slide, be prepared that the slide after that might show some things that are a little disturbing, but I will also give a heads up beforehand. So overall, we're going to be kind of putting this whole presentation in avian influenza, past, present, and future. And then at the end, we're going to answer any questions that you guys may have. So to start out, what is highly pathogenic avian influenza? So HPAI, or highly pathogenic avian influenza, is a virus in the influenza A family, and it can be broken down into two main categories. The first one is highly pathogenic, and this is also referred to as HPAI, and it causes severe symptoms, and it also has a high mortality rate as well. And for just all intents and purposes, you'll hear River and I interchangeably use HPAI, sometimes HPAI, sometimes bird flu, or highly pathogenic avian influenza throughout this presentation. So if you hear that, that's why. And then we have low path, which is LPAI. And again, this is just mild symptoms, sometimes asymptomatic, and it has a lower mortality rate. So the virus that we are currently dealing with, the one that we're going to be talking to you about today, is the highly pathogenic H5N1 strain. And this most current outbreak started in 2021. The last one you may remember was about 2014, 2015. So wild birds, poultry, and mammals, both marine and terrestrial, are going to be the groups most commonly affected with avian influenza, with H5N1. And waterfowl and shorebirds are going to be the hosts for this virus, which means typically they're asymptomatic. They don't have any of those clinical symptoms that we're going to talk about in a little bit. And it is spread through saliva, feces, and ingestion.
Okay, so we're going to talk a little bit about the history of HPAI, and you guys have probably heard this virus has been around for quite a long time. So avian influenza, it was first identified in 1878, and it was referenced by the name fowl plague. It was first seen affecting congregated poultry populations in Italy and other countries in Europe. And then even though this was when the first disease was documented, it has thought to have existed for potentially hundreds of years before. When it was first identified, they didn't even know that it was a virus. They didn't learn that until about 1902. And then it was further categorized as an avian influenza or an influenza virus in 1920. So they really didn't know a whole lot about it when it first started showing up. The strain that we're currently dealing with has ancestral roots in China in 1996 in farmed waterfowl. Over time, gene swapping has led to different variations within the N part of it. The H5 and then N kind of varies depending on genetic swapping of information. And the newest H5N1 strain that we're currently dealing with was first identified in late 2021, as Sophie said before. And it was detected in wild bird populations in Canada and the US, and it began causing outbreaks in commercial and backyard poultry in February 2022. And so here are some of the current numbers that we're dealing with. Of course, when it comes to humans, we've had 70 cases so far of this strain and 1 death. I want to preface this death was in Louisiana, and the man was elderly and had some pre-existing conditions. So it's not necessarily something that's going to be causing high mortality or high clinical symptoms within humans that we've seen documented thus far. In wild birds, there's been 12,510 wild birds have been detected with this virus so far, or this strain. And then there's been 166,417,893 poultry that have been affected by this virus. So very obviously it affects poultry very disproportionately compared to wild birds. And then for cattle, we have 17 states with outbreaks currently, and 985 dairy herds have been affected, which is, like I said, kind of pertinent to us as humans since we like to consume, cattle and poultry products, but definitely good to keep an eye on. But like I said before, the risk to the public is currently low, and human-to-human transmission has never been sustained with this virus throughout its entire history. And then here's a little picture graphic of all the states that have been kind of shown with human cases. Like I said before, this is all human, so it's not to deal with birds or mammals or anything yet. So with humans, there has been a total of 70 cases. 41 have been from exposure to dairy herds and cattle. 24 have been from poultry farms and culling operations. 2 have been from other animal exposures. And then 3 have been from unknown sources. So when they say other animal exposure, typically that means other like wild birds. Most of the time, you're not really going to be seeing this is like a civilian just going about your day. Most of them are going to be from farm workers or agricultural that are dealing with high numbers of congregated animals within an area. And I mentioned it is in cattle, so that is kind of pertinent to us as humans. Like I said before, we do consume a lot of their products. It was once considered rare, but mammals are becoming increasingly infected with HPAI. There are 17 states, like I said, with outbreaks in dairy cattle and over 985 herds affected. They have mostly been affected with a B3.13 strain, which typically causes mild symptoms in humans like pink eye, fever. But recently, cattle have been infected with the D1.1 strain, which is what we're currently dealing with in the wild bird population. This can cause more severe illness in humans, which is what that 41 out of the 70 human infections have stemmed from exposure to cattle. And then this is a little infographic, not to scare you, but to show you the different kinds of mammals that are being affected with HPAI and the kind of geographic range. So here in Alaska, we've had a lot of bears. We've had wild canines, and so those are the ones that are mostly being affected. We also see a lot of felines, domestic and wild felines have been pretty susceptible to this strain. And it kind of just shows you the widespreadness of this virus as well. But this is something that you're not necessarily going to be, concerned about. These are just a good infographic to show you where the virus is in mammals.
Okay. So we will answer any and all questions at the end. So symptoms, what does avian influenza look like? So as you guys, I'm sure, are familiar with, being so close to the Raptor Center in our small community, if you guys find a bird, we are the ones that go out and we get that bird. And so what are the signs that we are looking for? What are those clinical symptoms that we're looking for that tell us, okay, we need to be on high alert. This bird may be infected with avian influenza, and we need to act accordingly. So first of all, symptoms do vary between taxonomic groups, so that's important to note. And then also a lot of these symptoms are associated with other wildlife diseases. So if we go out and we see a bird presenting with one or maybe multiple of these symptoms, it's not absolutely 100% sure, of course, that bird is infected with avian flu. And that is where it is crucial to test and track the virus. The testing is really going to, of course, confirm that positive or negative. So in wild birds, these clinical symptoms tend to vary. We see a lot of neurological symptoms and we see a lot of respiratory symptoms. So neurologically, we're seeing things like head tilts or tics. We're seeing things like ataxia, which means incoordination. We see nystagmus, which is when you look at the bird's eye, you're going to see an uncontrollable shaking of the pupil, either side to side or up and down. We see things respiratory-wise like labored breathing or wheezing, and then things like corneal opacity, which is cloudiness in the eyes. And there's also more. So, this is not as studied as we would like. So, but generally, we know that once wild birds show symptoms, they have over a 95% rate of mortality. Okay, so this is where we're going to start showing you guys some videos. I do see some children in the room. These first 2 slides are really not bad. The third one and on, I'm going to give a little bit more of a disclaimer. So this is a bald eagle. So this BAEA 2439, that's just our ID system at the Raptor Center. And this was a bald eagle that came into us in October of 2024 from Haines, Alaska, from the Bald Eagle Foundation. And this bird, so if you guys aren't familiar, of course, we fly birds in either through seaplanes or Alaska Airlines. And River and I were actually the 2 avian care specialists that went out and got this bird from the airport. And of course, when you are traveling as a bird, that's a very stressful situation. So we expect some sort of thrashing around in the kennel, but we do a lot of things to mitigate any excessive stress. So that means when we get that kennel in the car and we're bringing it back to Pet's Choice to be triaged, we are not really talking in the car. We're not playing loud music. We're keeping it at a good temperature. We're doing a lot of things to mitigate excessive stress, but a little bit of thrashing is relatively normal. But I remember when we picked up this bird, it had sort of this, inside the kennel, it had sort of this rhythmic sort of shaking is the best way I can describe it. It ended up, we'll see a little bit later, we'll see what that actually was, but it sort of seemed to be rhythmically shaking in the kennel. It would start and then stop and then start again. And so we kind of kept that in the back of our mind. Do this. It's all right. I don't want it to fall. Oh, it's attached. Okay. Well, it may just stay there, I guess, as long as it doesn't break. Okay. And so we keep that in the back of our minds and we bring it over to Pet's Choice Veterinary Hospital where Dr. V and us as a team, we triage and we diagnose any injuries that this bird may have. And originally the call had come in, the bird was brought into Haines because it wasn't flying away from humans as they approached it. So that's of course a big red flag. So we bring it into Pet's Choice and we'll talk a little bit later about why it is we are bringing our birds to Pet's Choice and not to the Raptor Center. And we get this bird out of the kennel, we are restraining it and we begin our exam. And everything is relatively normal at first, right? It is nice and bright, it's alert, it's responsive to us. It's exactly how we would want a bald eagle to act when we are doing an exam on it. So we don't see anything incredibly suspicious in that moment. And so we create a rehabilitation plan and we bring this bird back to our quarantine facility, which is separate from the actual facility of the Raptor Center. We're very lucky to have that. And we go ahead and we put it into one of our quarantine, what we call pods. It's just a larger flight enclosure that we will put eagles or other birds in to kind of give them a space to fly around and continue to heal throughout their rehab process until we get a negative influenza test where they can then be introduced into the general population. And so when we put this bird down, immediately this bird is not really, it's not acting like a bald eagle should act. And River's gonna play this video for you guys right now, and you'll see me going up to this bird and kind of trying to get it to move forward. Let's see if we can figure this out.
Doesn't quite want to play.
Margot, we may need your help here. Is it a, maybe a space bar you could press?
So like the other one has a play button. This one, there it goes.
Oh, there it is. Perfect. Okay, sorry, technical difficulties. So you'll see me moving this bird and trying to encourage it to move forward, but he's really uncoordinated. His tail is sitting at an odd angle. It was wet prior, so it dried a little bit weird, but still it's sitting at an odd angle. Maybe that suggests sort of like a mind-body disconnect there. We don't really know. But he's not really moving appropriately. And that's exactly the opposite of what we want to see. So what we want to see is as soon as I take that falconry hood off and I put that bird down, he should be going the other end of the enclosure, away from us humans. That's what we want to see. Instead, he is very confused. And sorry, the internet's not the greatest, so it's having a hard time loading. But he is just uncoordinated. And in a minute here, you're going to see that he kind of looks around. And he's a little dazed, he's a little confused. As you guys heard me say prior, that's one of the symptoms. And he's just not really all with it. And in this moment, I said to River, I said, you know, this is a bird that is acting like it has avian influenza. And it was concerning in the moment because at this time, and the reason I'm not wearing any PPE, which I should have been doing, is that we hadn't had a positive in Sitka in months and months and months. And again, because this bird hadn't shown anything of concern during its exam. And so, he's looking around and he's just not acting like a bald eagle would act. I think we could probably just pause that there. I don't know if it's, I've kind of explained it. And so for this video, what happened next was, okay, this is concerning behavior. So I immediately call Dr. V and I say, this bird is acting suspiciously. It is very confused. It's incoordinated and something is completely off. And to be honest, it looks like a lot of the birds that I've gone out and rescued that have been tested positive for avian influenza. And so she instructs us to pick up that bird and to, based on our protocols, euthanize it. Because you guys heard me say prior that when wild birds are showing symptoms of avian influenza, there's over a 95% mortality rate. So as soon as we pick up the bird, this is what happens. We start seeing all over body tics. We see that rhythmic sort of shaking, the clenching of that foot, and all over body jerks. So, of course, we perform the euthanasia, we send out that test, and a few weeks later, it comes back positive for avian flu. So we go back, we completely sanitize, disinfect everything. We completely try to just make sure there's no contamination there. So this is bald eagle relatively recently. This was in December of 2024. We had 2 avian care specialists called out to some woman's house, and she had been with this eagle for a while observing it. And again, it wasn't flying away. That's very common. We hear that a lot about birds that are injured or maybe they're sick, that they're just not responding to humans in the way that they should. And there can be a lot of reasons for that. But she had mentioned, she was like, he's been here for a while and he's still not flying away. And so this video will show you, take a look at his head. You can see he has sort of this head tick or tilt. And he's doing that over and over and over again. And his body is at sort of a tilt. And then just a few minutes later, this is what we see. He's completely incoordinated, that ataxia that we talked about. And he's not even able to right himself up. He is trying to fly away. He's trying to orient himself, but he can't. And this can be very hard to watch, but this is what we see a lot of. So of course, we pick up this bird, we test it for avian influenza, and we immediately euthanize. That test goes out, and again, in a few weeks, it comes back positive for avian flu. All right, so this next slide, this was actually one of our first cases, first positive cases of avian influenza in Sitka. We know that in general, this current outbreak of H5N1 started in April of 2022. This was our first case. And this was a juvenile bald eagle that, again, was at someone's home in their driveway and was not acting as it should. And we'll play that video now. This one is a little bit more severe. So again, you'll see just complete incoordination. He's unable to orient himself. He has a lot of that beak chittering. He was making some vocalizations that I decided to take out because they are relatively disturbing to hear. And towards the end of this, and it's not shown in the video, but he actually ends up flipping on his back and he's unable to stand back up again. And because of how severe his symptoms were, we actually decided to euthanize on site for this bird because the amount, it's just, in our eyes, unethical to wait any longer. And so yeah, again, put out that test, came back positive for avian influenza. So that leads us to what our protocols are at ARC. If you guys have been following the avian influenza outbreak, you guys know that it's kind of waxing and waning. We have periods of high positive tests. We have periods of low positive tests. Of course, this is all going to be affected by migratory birds coming through, things like that. So that means that our protocols are going to be always changing. So we rely very heavily on Dr. V, our veterinarian at ARC, to be keeping an eye on tracking the virus and coordinating with our state veterinarian to make sure that we are keeping the best biosecurity practices that we can, and also be a resource for you guys as well. And so we are very lucky to have the support of our state veterinarian. And that means we can test every single bird that comes into us or that we go out and get. And we can test that and send that out to them, and they pay for everything, which is amazing. We'll talk a little bit about maybe how that differs for other centers in a little bit. But with this, protocols are always changing. Every Monday we have rounds where we're discussing our rehabilitation patients, and we're discussing avian flu. Month is going to look based on how many positives we have gotten. And so the first thing maybe that will change is all birds are triaged and tested at Pet's Choice. This hasn't changed in a very long time, and we don't know if it's going to. But this really helps control that we make sure no bird is entering in, even to our quarantine facility, that may possibly have symptoms of avian influenza and possibly come back positive for that. So again, if that bird has avian influenza symptoms, we no longer admit waterfowl, but we will euthanize at Pet's Choice. And I know you guys are hearing me say a lot about euthanizing. It's hard to do. It's a big part of our job, unfortunately. But it's incredibly important, for us to make sure that you guys know if you find any sort of bird that is suffering out there, if it is a goose or a duck or whatever it may be, please still call us, because not only do we want to get that bird out of the environment if it has avian influenza, as they are asymptomatic carriers, but also it is our obligation to make sure that we end suffering. So if that bird is suffering, it's not like we're going to turn that bird down. So please give us a call. And then we have varying levels of lockdown as well. So this is based on those protocols. Raise your hand if you've been to the Alaska Raptor Center. Wow. There's a few hands that are not raised. You guys should come. So if you guys have been to the Raptor Center, on our back deck, we have the open eagle habitat with Oliver, our golden eagle. We have a few of our male and female bald eagles back there. But that means they're really susceptible to anything that flies over and poops into their enclosure. We are right next to the Indian River, so that is really troubling sometimes. And so those eagles are going to be moved inside accordingly to help lower their risk of contraction. And then time of day for rehab treatment. A lot of facilities have the luxury of having a separate rehabilitation staff from the from the educational ambassador team. As you guys know, we do both. We have our educational ambassadors that we do programs with, and we also do rehabilitation. But for us at ARC, we do everything. And so with this, if we have a lot of positives in town that week or that month, then we are going to make sure to do our rehabilitation patients at the very end of the day. And when we go out and we do those birds in the quarantine facility, we make sure not to come back into the facility. So we say, end of day, you don't enter back in. And then we have specific rescue equipment and leathers. If you guys have ever seen us out on an eagle call or rescuing a bird, you might have seen us donning those welding leather jackets with our leather gloves. And so we have 3 sets of these, one for in-clinic use, for just our educational ambassador birds when they need to be examined or have their routine health exams. And then we have a set for our quarantine, and then we have a set for actual rescues as well. And then working with ambassadors. Again, when it's when we have a lot of positives out there, if we go out during a shift to a bird call, which we of course cannot control when a bird needs to be picked up and when you guys give us a call, then we may not work with ambassador birds once we return, even if we're changing our clothes. Sometimes, depending on the protocols at the time, maybe we'll go home and shower. Maybe we will change our clothes, but when things are really, really on red alert, we just don't do that because it's just not worth the risk. And of course, our obligation lies with taking the best care of them as we can. And then PPE for rescues. Again, this is going to vary based on the amount of positives. So you'll sometimes see us out there in full Tyvek suits, full, N95s. We have our gloves, and then we are either completely changing our boots or we are scrubbing them with a disinfectant and a sanitizer that we know kills avian influenza, and we go from there. So this is a video I want to say that if there are children in the audience, this video does show a deceased bald eagle, and it does show blood in the mouth, and quite a bit of it. The reason I want to show you guys this is to kind of give you an inside look of what triage and testing looks like at ARC, what we do for every single bird that comes into us. And just to kind of reiterate some things, so all the birds that are admitted, either alive or dead on arrival, are tested, because we know that the avian influenza virus does not die with the bird. We don't know how long it survives in the environment because there's not enough studies out there right now. But we do know that cold does not kill it, but heat does. We'll talk about that a little bit later if you have questions. And then those results are going to be sent out. In about 2 weeks, they come back. And that, of course, is helping track the virus. If they're symptomatic at triage, they are euthanized. And if that bird has no avian influenza symptoms, we will bring that bird back to our quarantine facility, and we will get it set up until that negative test is back, and we can introduce it back into the general population, whether that be in our ICU or in the Bald Eagle Flight Training Center if it's bald eagle. So this video is going to give you a little insight of how we test. This isn't to say that we expect you guys to go ahead and do this. That's the opposite of what I'm saying. But it's just to kind of give you an idea of what we do and why we do it. And we'll play it for you now. Hopefully it loads.
Oh no.
No, not the beginning.
Yeah. It's like right on the other one. Oh, that's too far. Don't look at that.
Close your eyes. Okay.
We can't press it. Okay.
There we go. Is there sound?
No.
Okay. Can we get sound?
I don't know.
Margot? Yeah. Sorry. Can you pause it?
Apparently I lied. We do have a video.
Okay. I don't know. Will you go ahead and play it so I can
Sorry,
tell
guys.
how loud it is?
There's always going to be technical difficulties.
Is the volume up on here as well?
Oh, if you want to pause it, River.
Well, okay.
Thank you. This is a great still. Okay. Hopefully you're not traumatized.
Yeah.
I do kind of need it on to figure out how loud.
Maybe this will help you guys sympathize with us.
Sophie, we have to play it to understand if there's sound.
Oh, I see. Okay.
I can't because it's stuck on the. Every time I go near the back video, it pulls up the presentation.
Well, so maybe I could just. Maybe I'll just narrate.
I was gonna say you could just interpret it.
I'm just gonna narrate it.
We'll see if it even can start over. See?
Yep.
That's what I'm trying to do with them.
Yep, you're totally right.
Okay. Thank you. Okay. That's
No,
okay.
no sound.
No.
Okay.
We're just gonna
So
Okay.
here's Dr. V modeling on how to test. This is a bald eagle, again, a deceased bald eagle, and she's instructing on how to find the cloaca. We do 2 different points to test. So we take a swab from the cloaca, which she is showing you now. She's grabbing the feathers. She does about 5 swabs around and takes it out. And then the next swab that we take is from the mouth. Again, there is a little bit of blood. And she's doing, again, about 5 swabs going up through the slit there. Making sure to collect a really good sample. And then we take that out. We break off the swab and we put it into a little tube that is then labeled with that specific bird ID based on what number that bird is coming in for the season. And that test tube is sent out to the state veterinarian, and then they will test it from there. So keeping yourself and your community safe, where do we go from here? So of course, report sick and dead wild birds. This one is incredibly important, again, because we want to get avian influenza out of the environment as soon as possible, because again, we are seeing a lot of birds that are scavengers like bald eagles, ravens, crows, and things like that become infected with avian influenza. So if you see a bird or a bird that's acting abnormally, please give us a call. And then we will also provide you guys some information at the end of if you have a sick chicken or anything along those lines, the appropriate routes to go to report that. Keeping up to date on information, As I'm sure you guys are all familiar with the time of COVID, things can relatively change rapidly. And so keeping up to date on the CDC's websites to kind of either track the virus for yourself or look at updated guidelines on how, on best practices when it comes to biosecurity, all of these things are incredibly important. I will say that under this current administration, we are seeing a lot of pages regarding avian influenza being historically archived. And so I always want to make sure you guys know that we are also a resource for you guys as well, because again, you heard me say Dr. V keeps a very close eye on these things, and she has a relationship with our state veterinarian. So if you aren't sure and you can't find that information online, please give us a call. We'd be happy to direct you guys. Keeping your cats indoors and away from wild birds and droppings. This town, we love to have our domestic cats outdoors, and I'm not sure why, because guess what? Cats kill over 3 billion birds every single year. That's billion with a B. They are incredibly harmful to our wild bird populations, and also it's very unsafe for them, not only because of all these other human threats, but now because of avian influenza. So if your cat goes out and it eats a bird that is infected with avian influenza, of course it can contract it that way, but it can also just interact with that infected feces or those droppings and contract it that way as well. So keeping your cats indoors is very, very, very important. Avoiding raw food and drinks for yourself and also your pets. If you're drinking raw milk, please do not. Pasteurization, which is just heating that milk up to a temperature that kills all of those viruses, is incredibly important for keeping everybody safe and along with your pets as well. Washing your hands often and thoroughly. This is great for any time of the year, especially flu season, things like that. Just make sure you're always washing those well. Removing your shoes before entering your house. We have beautiful Swan Lake. We live in a place where there's a lot of birds that congregate in different parts of town. So making sure that if you're in those places where there is a lot of birds, if you're feeding the birds down at Swan Lake, whatever it may be, to change your shoes before you go inside. And then donating to wildlife centers. You guys heard me say before that we have the luxury of being supported by our state veterinarian, but there's a lot of wildlife centers right now that are taking on that cost to test every single bird that they get in. And that's $75 for the test alone, not including the FedEx packaging that goes and gets that test to the state vet of theirs. And so please make sure if you guys follow anyone on social media that you particularly like for a wildlife center. You don't have to be local. This can all be done online. Please support your local wildlife centers. Backyard chickens. So you guys know that Dr. Wolf is going to be giving a much more extensive talk about keeping backyard chickens, and we'll touch on this a little bit. But how to keep your flock safe, knowing the symptoms and report will give you a certain number that you want to report your sick or dead chickens to. That's going to be your private veterinarian or a hotline will give you. And the symptoms are going to be a little different than what we see in wild birds. So we see a lot of things like sudden death, lethargy, diarrhea, nasal discharge or wheezing, blue colored comb or wattles, or swollen comb, wattles, or head. And then don't touch the sick or dead chickens, making sure to wear your proper PPE, because a lot of times, going back to that don't touch sick or dead chickens, sometimes they'll dispatch people to come out and act accordingly. So again, wear your PPE, making sure to prevent contact with wild birds. So you're going to limit the roaming of your chickens, making sure there is a roof over your chicken's enclosure so that wild birds cannot poop into your chicken space, and making sure to disinfect and sanitize. We have specific disinfectants and sanitizers that we use that we know kill avian influenza. And so we'd love to share that information with you guys if you're interested. And having dedicated shoes and clothes. So if you're going out to your chicken coop in the morning, put on your chicken boots and take them off before you go in your house. But it doesn't stop there. That also means you want to change your pants and your shirt and making sure to wash your hands really well as well. If you're really aerosolizing a lot of their droppings, making sure to wear a mask. And then following CDC guidelines, and also quarantining new members too. If you guys are bringing in new chickens from Ace Hardware, make sure to quarantine those birds for 1 to 2 weeks to make sure you're very closely monitoring any sort of change in any of these symptoms that we listed below.
Okay, so I know a lot of people in town do have cats, and Sophie kind of touched on that a little bit. But the FDA has warned that felines, including domestic and wild cats, have been particularly susceptible to this newer strain of HPAI. There's very limited data, however, but there is a current mortality rate between 50 and 90% once that cat contracts the virus, which is insanely high. But like I said, there's not a whole lot of, information. There's not a big data pool to make this average out of, but the current numbers that we're seeing, the mortality rate for felines is incredibly high. The risk of contraction is low, like I said, especially with these extra precautions. You want to make sure you keep your cats indoors. You want to avoid raw food, like Sophie said, raw milk, a lot of like raw chicken, beef, those kinds of things. Just make sure that you're getting it from a reputable source, and make sure you're not feeding your cats or any pets really any of that potentially contaminated food. And another thing is change clothing before entering inside. Sophie kind of talked about it a little bit, but if you're going down to Swan Lake feeding those swans and geese, and then you have your shoes on when you enter your house, I know my cat loves to chew on my shoelaces. So that is a really big potential for that cat to contract the virus if you were to pick it up on your shoes. So just making sure if you do interact with any of our wild spaces and go back into your home, you're just keeping your own pets safe. The symptoms for cats include fever, lethargy, low appetite. There's lots of different symptoms. If your cat is acting a little bit more funky than usual, make sure you contact your vet, and if you're concerned about any certain thing. And then kind of looking towards the future, where do we go from here? So increased funding in legislature towards biosecurity in agriculture has already made a really positive impact in controlling the spread. Prevention of the disease through vaccination is incredibly crucial, and it has been approved for development within the use of agricultural settings in the United States. Like I said, prevention through vaccination is super important. Increased biosecurity. That's kind of a big kind of scientific word that we put onto it, but it just means that we're preventing the disease from entering any certain area. So if we have a sick bird, sick cow, sick anything, we want to make sure they're not coming into contact with anything else so that we can prevent the disease from even getting into the pool. And education is super important for everybody. I mean, you guys are doing it right now, educating yourself about this virus. I know I learned a lot from just doing this presentation, so making sure you're keeping up to date on information is great for this. And there's been a lot of talks about vaccinations for humans. So we do have a seasonal flu vaccine. I always recommend getting that, especially for this kind of situation. There is a potential for rapid mutation when and if this virus decides that it wants to go to human transmission. But the efficacy of preparing for this ahead of time is not necessarily supported. There has been 3 vaccinations based on the previous H5N1 strains that have been approved for use in the United States, and they're currently being stockpiled for pandemic preparedness in the United States if this virus were to jump from human to human. Like I said, it's not necessarily likely, but it is plausible given the amount of cases that we're seeing on the rise, especially within mammals. But like I said, prevention through vaccination, if this does become an issue for humans, getting that vaccine is very important to make sure you protect yourself, but also everyone around you. We also want to make sure we limit chances of gene swapping, like I talked a little bit about before. If you were to get both the seasonal flu plus this, you're probably not going to have a good time, but the genes in your body are going to be swapping and potentially could cause a lot more mutations, which is not necessarily something what you want. And overall, vaccines are great. They increase your immune protection. So, yeah.
All right. We talked a lot about some heavy stuff, right? But this is Otis. He's one of our our educational ambassador, Western Screech Owls. River is the primary trainer on, and he brings us a lot of joy every single day. And it's important when we do a lot of heavy work, a lot of work that involves euthanasia, a lot of mental toll. It's really nice to be able to work with our ambassador birds. And then contact information. We have our Raptor Center number, Pet's Choice, and the Alaska Sick or Dead Bird Hotline. So this is important, if you have your GPS coordinates, that is ideal. But they would also like species and time found, and this is only if the cause of death is not apparent. So, and then to report illness or death in your flock, you can report that to, again, your private veterinarian first, and then also the Office of the State Veterinarian, and this is the number below. Please take a screenshot if you would like. But we can also leave this up. But I do want to show you this next slide because it is very cute. Oh, okay, here you go. There you go. Yes. And thank you guys. Thank you guys so much for coming out and being willing to learn about avian influenza and how it's affecting Sitka and Alaska in general. This is Via. Via was a 3 to 4 week old bald eagle that we got in this past summer. It was the youngest bald eagle that we had ever admitted at the Alaska Raptor Center. And she was clearly not a bald eagle, but a ball of dryer lint that I guess just found its way to the Alaska Raptor Center. She was a joy to rehabilitate, and she was just released at our bald eagle spring release on March 22nd, if any of you guys got to see that. So yeah. Oh yes, and also check out our YouTube channel. We have a wonderful social media manager who will post a lot of beautiful content, but also he live streamed that bald eagle spring release. If you guys didn't get a chance to attend, please watch. We go through the stories of the birds that were released, how long they'd been there, and you can see all the hard work pay off. All right, that's it. Okay. So, any questions? I had one over here. Maybe. Did we answer? It's been a while.
Well, way back in the beginning, we were showing the map of Alaska.
Put the contact info back up.
Oh, yeah.
I was just wondering, has there been more than one bear identified in Southeast, and where was it?
So I don't necessarily know exactly. Do you know?
It was Glacier Bay.
Glacier Bay. I saw little dots kind of everywhere on that map. So yeah, you probably know more about it than I do.
Yeah, it was black bear up in Glacier Bay, I think. I don't know if more have been identified since then. I heard that there were more.
This was the most recent map that I pulled 2 days ago, I want to say, was when I put this in this presentation. So it should be pretty up to date, I think, maybe.
It's also, oh, sorry, go ahead.
Well, I was just gonna say, is there, like, do you know, like, how many do humans see versus how many are probably in the wild? Is there any estimate of that?
That's a really good question. It's hard to say, right?
Well, when we were learning about this, we were looking at numbers, and Minnesota actually had the most diagnosed, but I think that was totally inaccurate because they have so many more people to find the sick and dead birds. In Alaska, you know, there's gonna be so many birds that we haven't found. I haven't even told you guys this, but I talked to someone in the ADAC who told me it was unbelievable how many bald eagles were gone from avian influenza out there. And I hadn't heard that. Nobody in ADAC was picking them up or testing them.